How do entitlement programs really work in the US? Imagine a system where certain groups of people automatically qualify for benefits because of who they are or what they need. That's what entitlement programs do in the United States. They are government initiatives that provide money or health care to specific groups like the elderly, low-income families, and people with disabilities. The biggest ones are Social Security, Medicare, and Medicaid. These are called entitlements because if you meet the rules, you are legally entitled to benefits, no matter what the federal budget looks like. Social Security is a retirement program. People pay into it through payroll taxes during their working years. When they retire, they get monthly payments based on how much they earned and how long they worked. It also helps survivors of deceased workers and people with disabilities. Medicare is health insurance for Americans aged 65 and older. It is funded through payroll taxes, premiums paid by beneficiaries, and some government money. It covers hospital stays, doctor visits, and some prescription drugs. Medicaid helps low-income individuals and families get health coverage. It is funded jointly by the federal government and states, and each state manages its own program within federal guidelines. From a Republican point of view, these programs raise questions about long-term financial health. Social Security and Medicare face funding issues because of the aging population. Fewer workers are paying into the system while more people are drawing benefits. Republicans often focus on controlling federal spending and reducing the national debt. They worry that if these programs aren't reformed, they could run out of money, leading to cuts in benefits or higher taxes for future generations. Recently, many Republican voters are showing support for keeping or even expanding these programs. This creates a challenge for party leaders who want to cut costs but also want to keep older voters happy. On Medicaid, Republicans usually prefer giving states more control through block grants or waivers. This approach aims to reduce federal spending and let states decide how best to run their programs. But since many working-class Americans relying on Medicaid, cutting it too much could be unpopular. Republican proposals for reform often include raising the retirement age, changing how benefits are calculated for higher earners, and encouraging private savings plans. They also want to crack down on fraud and waste to make the programs more efficient. The debate is complicated because many Americans depend on these benefits, especially older voters who tend to vote more often. In essence, Republicans see entitlement programs as necessary but needing adjustments to stay sustainable. They want to protect benefits for those who need them, most while finding ways to slow down spending growth. This might mean encouraging personal responsibility and reducing the federal government's role where possible. But balancing fiscal responsibility with public support remains a key challenge for policymakers.